Whenever you're ready.
All right. Good afternoon, Commissioners, and welcome to today's budget hearings for the 2023 recommended budget. Our first hearing today is from the Alcohol, Drug, and Mental Health Board. At this point, I'll turn it over to CEO Erica Clark-Jones.
Thank you, Director. Great to be with you all today. And President Crowley, Commissioners Boyce and Commissioner O'Grady, County Administrator Kim Wilson, thank you. Thanks for positioning us to come before you this afternoon. I, along with the ADAMH Senior Leadership Team, is pleased to be with you today. I'd like to introduce the members of our presenting team in speaker order. So I will kick us off this afternoon, and Dr. Amina Kimavor, our Vice President of Advocacy and Engagement, will follow. Sue Valillo, our Vice President of Clinical Services and Assistant Chief Clinical Officer, will speak today. Jonathan Thomas, our Chief Operating Officer, and then you will hear from Allison Waters, a new addition to our team, and she serves as our Senior Finance Director. I would also like to acknowledge the contributions of our Chief Financial Officer, Mr. Patrick McLean. He is out on a previously scheduled medical leave today, but he has been engaged in our 2023 budget process and submission and a portion of this presentation. So this team that has joined you this afternoon, and I also would like to acknowledge Mr. Joe Florensky, our Senior Director of Administration, who's going to keep us honest with our slides this afternoon. And Joe, you can go ahead and go to slide 3, if that's okay. This team that you're going to hear from today represents over 50 staff members committed to improving the well-being of Franklin County residents through accessible, equitable mental health and addiction services. Thank you. Mental health and addiction services delivered through our network of more than 30 community-based providers. ADAMH views our community investments through 6 systems of care. And I know you all have heard this throughout the years, but I think it's really important to remind folks of those 6 systems of care, because I'm going to start my presentation off today talking about one of these, and that's crisis. But the 6 systems of care include prevention, treatment, recovery, housing, family supports, and of course, crisis. Next slide, please, Joe. This year, as several of you know, especially President Crowley, and Commissioners Boyce and Commissioner O'Grady and County Administrator Wilson, this year an unplanned disruption occurred in the provision of community-based crisis care. On July 28th, ADAMH received a notice from Netcare Access to discontinue 24/7 crisis services at 199 South Central Avenue, and that's in the Franklinton community here in Columbus. The Netcare team began winding down their services by reducing hours in waves. The first wave of hour reduction came at the end of August of 2022, this past year, and steadily it happened over the months of September and October through this most recent set of hours, which is 8 to 4 p.m. Monday through Friday. Netcare Access in their 24/7 clinic only is scheduled to close on November 25th, and that's next Friday. Again, it's just the 24/7 clinic and not necessarily the provider. They continue to provide other services, critical services to our community. But at the same time, as you all are aware, our community is planning for and has been planning over several years for the forthcoming Franklin County Mental Health and Addiction Crisis Center, which you will receive an update today in our presentation. The groundbreaking for this center is scheduled for the first quarter of 2023. And construction time will take we're estimating about 20 months. So the center is scheduled to open in the first quarter of 2025. This projected gap in community-based crisis care, right, from the time that Netcare will close next Friday to the time the crisis center opens, presents a challenge for us as a community, and quite frankly, to our patients, to our community partners, and our adult serving hospitals. In response to this challenge, our community of providers that are in our network, even those outside our network, our hospital partners, including Twin Valley, public safety forces, and Ohio Mental Health and Addiction Services, among others, came together to explore community-based options to bridge this time span to the opening of the forthcoming crisis center. What we did from the time we received the notice, and quite frankly, up until last night, we collected several recommendations from our community partners. But key among all the recommendations was the restoration of 24/7 community-based crisis care. Along the way, along the way of this wind down of one of our key partners here in Franklin County, we supported Southeast Healthcare and the downtown SID, who we have dubbed the parking lot Samaritans, and you see there on the bottom of your slide. But they supported patients during the initial wave of NetCare's wind down hours and their reduction of hours in September. We supported that work with levy funds. In October, Maryhaven, a key community partner, expanded their access to crisis substance use disorder care for the public, for the general public, and for hospitals. This service expansion remains in effect today and will continue throughout this bridge period of over 2 years. And as of yesterday, our board our team, our ADAMH team, with the support of the prosecuting attorney's office, reached an agreement with NetCare Access to support a sublease of crisis clinical space at 199 South Central Avenue for RI International. This is a new provider to our space, but they are also the presumed operator at the forthcoming crisis center. But we will be supporting a sublease for RI International to deliver crisis care at the 199 South Central Avenue site through March of 2025. As NetCare winds down their delivery of services, RI International will ramp up to a 24/7 clinic. Services are scheduled to ramp up at the 199 South Central Avenue location with limited hours on January 9th of 2023, with the goal of offering 24/7 care by February 20th, 2023. In this interim period of NetCare's closure through January 9th, care at Maryhaven and the hospitals will be encouraged. We know that this is a challenging time of year for the people that we serve, and so we think it's very important for us to communicate broadly. Our communications team will share and promote messages that encourage the use of 988, which you'll hear more about as our community rolled that out this past year, and hospital care until RI opens its doors in January. Our board and our team is grateful for the partnership across agencies, our partnership with Franklin County to respond to the evolving situation so quickly, to be able to continue to meet the crisis needs for the Franklin County residents in the community. What would have been a 2-year closure will only be about a 40-day closure before RI ramps up on the west side in the location that our patients are used to going to over the last 2 decades. So we're very proud of that. Next slide, please. So, delivering support for accessible, equitable, and culturally appropriate behavioral health care continues to be a priority for Franklin County ADAMH. You saw that just in, frankly, the way that we handled the NetCare closure, and it dominates everything that we do. And that information is backed up by our recent community needs assessment that had different populations wanting more access and timely access and access to quality services in our community. Over the last year, ADAMH created an agency equity scorecard to monitor our progress of our stated goals from our 2020 resolution declaring racism as a public health crisis. 80% of our initiatives are in process, including the collection of ADAMH data disaggregated by race and ethnicity. Our approach to data collection was recently highlighted by the Health Policy Institute of Ohio as a model practice that they shared statewide. ADAMH Franklin County goals are also aligned with the Ohio Mental Health and Addiction Health, Equity, and Cultural Competency Plan, and we have received state financial support for the advancement of our agency equity goals around the creation of community-wide behavioral health workforce development council. This important and timely work is led by our Senior Director of Human Resources, Carolina Trindaji, and Vice President of Advocacy and Engagement, Dr. Amina Kimavor. At this time, I will turn the presentation over to Dr. Kimavor to offer additional details about this significant initiative and efforts to deepen equity efforts across our community. Dr. Kimavor, as we call her, Dr. K.
Thank you, Erica. Good afternoon, commissioners, administrators, and fellow colleagues. I'm very excited to talk just briefly about the Behavioral Health Workforce Development Council that ADAMH is proudly leading here in Franklin County. And so knowing about the shortages that really just increased because of the pandemic, we knew that this is something that we needed to launch sooner than later to really be able to respond to our community. So the mission is really to create, advise, and implement a strategic Franklin County workforce development plan that centers itself on the behavioral health shortage. Things like increasing or assisting in the recruitment and the retention of our diverse local workforce are very important to us, as well as identifying funding opportunities that would be helpful in this space as well. Services capacity is also something that we are looking at. Strengthening career pathways is really important. We are collaborating. I'll share more about our membership here in a moment, but we are in connection with a local higher education institution that is looking at the behavioral health workforce life cycle in that space. So from, early childhood all the way through, higher education, and promoting policy and advocacy. And so you can see here on the slide the deliverables that are highlighted: to create, to build, to advise, to advance, and to design and implement. The cadence I thought was really nice regarding how we would approach this work with immediacy. And this was something that was organically evolved out of that launch. The members decided that they wanted to meet every other week to tackle this. And in addition to that, sometimes we will have in-between meetings for those who would like to just give additional feedback, if you will. So we just came off of one of those. So give you an idea of who is part of our membership. Our K through 12 and higher education partners in the education space include, not limited to in any of these just for the sake of time, but Capital University. I mentioned the other institution regarding the behavioral health workforce life cycle. That's the University of Dayton, Dublin. Franklin County is one of their targeted areas for a $1.9 million grant that they received, I want to say about a year ago. Maryhaven, St. Vincent, the Peer Center within our provider network, and several others. With regard to the Central Ohio workforce, entities and agencies such as the Columbus Chamber of Commerce, Rise Together Innovation Center, and the Workforce Development Board of Central Ohio, also inclusive of community voices that include the Somali Chamber of Commerce and the Ohio Latino Affairs Commission. So we're really excited about this work and look forward to having a plan together somewhere near the top of 2023 at the rate that we're going. So a lot of engagement there. In partnership with this particular initiative is equally important, and that is the Cultural Responsiveness Training Series that is happening in collaboration with the College of Social Work at Ohio State. We actually just came off of this year's series, which started in July, to really address clinicians, educators, administrators, community members, ability to be able to respond to our communities as it relates to the diversity that we have here in Franklin County. And so from a clinical perspective, we were able to bring in educators, administrators, and clinicians that were here locally, statewide, and nationally to provide us with responsiveness training on some of the areas that you see here on the last bullet point on the screen, like power, race, and gender, microaggressions, the multifaceted dimensions of race focused on racial identity, disparities in behavioral health. We had a panel last week for that, and then also suicide prevention. And so we're going to debrief and look further into what this will look like in 2023. But the word responsiveness is intentional because we are all been challenged to act in this space and not just, come to a training and walk away. So overall, I guess for these two things, I would say that these are two really strong seminal pieces of work coming out of the ADAMH board. And I'm very excited to be a part of both of these because I know that they are very responsive to the communities that we serve. I think I will kick it over to Sue, I believe is next.
Good afternoon, everyone. Thank you for having me this afternoon. I am happy to speak with you about our collaborations, our work with RISE Together, as well as start to share some information about our crisis continuum of care. Next slide, please. So it's important to know that ADAMH collaborates with both Columbus Public Health and Franklin County Public Health, as well as our local hospitals on community health assessment and planning efforts. Both health departments are required by the Ohio Department of Health to complete a triannual community health assessment, or CHAW, and a community health improvement plan, or CHIP. The nonprofit adult serving hospitals, Ohio Health, OSU Wexner, and Mount Carmel, as well as Nationwide Children's Hospital under the umbrella of the Central Ohio Hospital Council, also complete an IRS required triennial community health needs assessment and implementation strategy. This past cycle, all three of those entities, both health departments and the Central Ohio Hospital Council, collaborated to develop a comprehensive community health assessment that resulted in the Franklin County Health Map. Both Franklin County Health Works and the Columbus and Franklin County Addiction Plan, or CAFCAP, as it's called, resulted from the CHIP planning. That's a lot of acronyms. Hopefully they're all displayed appropriately on this slide. As part of HealthWorks, ADAMH staff are participating in work groups focused on racial equity in behavioral health and addiction services. And as part of CAFCAP, ADAMH representatives serve on community work groups to combat drug overdoses through prevention, education, treatment, recovery, as well as data collection. Next slide, please. We wanted to share a few of our very specific activities that are related directly to the RISE Together plan. Goals from each of the 4 areas of the plan have been noted: jobs, housing, health, and youth. And again, this is just a sampling of some of how our work connects with the goals in this plan. So for the jobs, goal number 3, ADAMH is actively engaged in peer training and certification for people with lived experience of mental health or addiction disorders, as well as developing employment opportunities throughout our system in a new crisis center opening in 2025, as Eric had previously mentioned, that employs certified peers in all levels of care throughout the entire program. Goal number 5 with housing is around increasing the supply of equitable opportunity to access quality housing, and ADAMH activities include supporting of permanent supportive housing for people who are living with a mental health or substance use disability, as well as recovering housing, particularly for men and women, to allow them to bring their children in with them while they are in recovery. Health goal number 9 is to reduce overall racial disparities. And we very recently, under the leadership of Dr. K, implemented faith leader training focused on mental health and suicide prevention throughout the community. Next slide, please. In relation to health goal number 10, ADAMH is and has been working with law enforcement throughout Franklin County to provide crisis intervention training to assist law enforcement first responders in managing behavioral health crisis when they are called to a scene where that is the subject of the incident that's occurring, so that they are able to manage the situation that best meets the needs of the person experiencing a crisis. We are also engaged in increasing access to SUD treatment, both through mobile services and neighborhood-based services all throughout the community. And lastly, in relation to the goal number 11 for youth, increasing student success for students near the poverty level, the mobile response stabilization services have been implemented with Nationwide Children's Hospital. Those services respond to youth 17 and younger who are experiencing a behavioral health crisis in the community. This response allows a clinician to go to the location where the youth is. Often it's a school, it could be a home or other locations in the community to help respond to the crisis that the youth is experiencing. In addition, the ADAMH board supports school-based prevention services throughout all 16 school districts in Franklin County. Next slide, please. I will now share a little bit of information about our continuum of crisis care. We really talk about this in 3 ways. First is a call center, someone to call. So when there is a behavioral health crisis, we all know in this community who to call in order to get help. Then someone to come. It's a mobile crisis response so that people who are in crisis have someone immediately able to come to them to help resolve the crisis. And then last, and the cornerstone of this plan, is our crisis center, somewhere to go for someone who's experiencing a behavioral health crisis. Next slide, please. You all may be familiar with the 988 crisis line that was federally mandated in July 16th of 2022. It connects people who are experiencing a behavioral health crisis to national suicide prevention lifelines to deal both with suicide prevention as well as other types of behavioral health crisis. We are fortunate in this community that we have 2 local responders to the 988 crisis line. That is North Central Mental Health Services as well as NetCare. Both have been operating crisis lines in this community and are well trained in how to respond to someone experiencing a crisis. There are, in addition, about 7 other 24-hour crisis hotlines in Franklin County that at some point will collapse into the 988 hotline, so that we create a no wrong door. Anyone in crisis calling any of the hotline numbers in Franklin County will be able to get a warm handoff to get the assistance that they need. We've also been working very closely with all of the 911 call centers in Franklin County to ensure that there is collaboration and the ability to transfer calls between 988 and 911 as needed. While this was a soft launch in Ohio in 2022, we know that from August of 2021 to August of 2022, there was a 109% increase in calls to the suicide prevention hotlines. This service will cost about $130 million in the state of Ohio over just over 5 years. And while the Ohio Department of Mental Health and Addiction Services is providing startup costs, there is no sustainable funding for this service, and we are looking forward to working with the legislation to find a permanent funding solution in this year's budget process. Next slide, please. The next part of our crisis continuum then is mobile crisis. We are looking at developing a tiered response for Franklin County that includes 911 and law enforcement as the first line of response. The second line of response is a co-responder model, both with CPD and with the Franklin County Sheriff's Office. This includes a clinician embedded with law enforcement to respond to a behavioral health crisis. The CPD program is underway in the Franklin County Sheriff's Office. We are working with right now to get that program launched. We are then working on a community response that will not include law enforcement. This will be a clinician and a peer who are able to respond to a behavioral health crisis, freeing up our first responders to go to where they're most needed. Then both the co-responders and the community response will be able to provide follow-up for those folks in the community that they have intervened with in a crisis situation. Currently, ADAMH supports additional mobile services, including our reach out workers, managing public inebriates within Franklin County, the MRSS program, which I mentioned earlier, responding to crisis for youth 17 and younger, and then other mobile crisis teams, most notably REACT and SPARK, which are dispatched through EMS. And with that, I will turn it over to Jonathan Thomas, who can share with you about our upcoming crisis center.
Thank you, Sue. Good afternoon, commissioners. So as Sue mentioned, I will continue our crisis services update by moving to that third feature of the continuum, the crisis center for somewhere to go for those in need. Next slide. As a high-level overview of the 3 distinct levels of care that are planned for the new crisis center, there will be a 24/7 walk-in unit for lower acute encounters, or what we would consider to be comparable to a behavioral health urgent care setting. The core of the crisis center programming is the 23-hour observation unit, which is designed to provide stabilization for individuals, whether voluntary or involuntary, when they present at the crisis center, to ultimately facilitate linkage to their next or ongoing level of care, whether that's returning to the community or moving to a higher level of care. And lastly, we have planned an inpatient capacity, which is intended to support the operations and flow of individuals at the crisis center. So if someone is in need of an inpatient level of care and unable to access those beds in our community, they can move to this on-site unit, allowing for continuity of care and then assuring the 23-hour observation unit remains available and does not go on divert. Regardless of where someone is in the center, any of these 3 levels of care, the additional services on this slide will be available as wraparound services. And again, it's not limited to one of those functions. Anywhere in the facility, you'll be able to have substance use services, family support, linkage, and basic medical care needs met. Next slide. A quick reminder, we are planning the construction to occur in the West Edge area. For those that are more familiar with this area, our property is located immediately to the east of our colleagues at Franklin County Children's Services. We've been very fortunate to be a member of the West Edge Association and have been working very closely with our neighbors in that community in bringing this project and this center to the community as a whole. Next slide. Here I have selected a few of our recent accomplishments and some upcoming milestones. Having recently moved beyond our design development phase of the project, we are now initiating work on early bid packages with support from our partners in public facilities management. And we're happy to share that in the last few weeks, we've received unanimous support for our rezoning application from both the Franklinton Area Commission as well as the city's Development Commission. The next step in our rezoning for the property that we own on Harmon Avenue is we will go before City Council on December 12th, and following what we hope and believe will be approval from Columbus City Council, that puts us on target for the groundbreaking in January, as Erica had mentioned, as well as services initiating in early 2025. And so for my last set of slides, I get to share some of the renderings that came out of that design development set. So we're very excited to share these with you all. Because we think putting a picture and beginning to make this more real, as opposed to many of the talking points we've been having in our community for years, seems to really resonate, and we're very proud of where we are in this design process. Next slide. This is an aerial view of the Harmon Avenue property, which does now have an address, 465 Harmon Avenue. We received that address last week. So this is an aerial view, and the one thing I emphasize here is showing this would be looking at it if you're driving east on 70. So the Children's Services is kind of off to the right of this image. You can see Comtex Laundry at the top end of this image, and then ECDI's building is to the left. But regardless of whether someone's in either of the observation units or in the inpatient unit, which will be located on the second floor of this facility, we've been very intentional about creating that access to outdoor space. We know that's an important part of recovery and healing for individuals. So being very mindful of that care experience. And so you'll see some of that intentionality even in this rendering. And the more we get into the building, you hopefully will see we've carried those recovery-oriented design principles throughout this process. Next slide. This is bringing you down on grade. And so if you're potentially someone's coming off of one of the CODA bus stops that are immediately in front of Harmon Avenue, Children's Services on Mound, and crossing Souder Avenue, this is how they would approach the front door of the building. So this is the public entrance that you would be approaching. Next slide. I also want to show we have a dedicated first responder point of entry. So we wanted to keep that traffic separated from the public or walk-in traffic. So there is a specific area for our partners in law enforcement and EMS to be able to bring somebody in. We have a covered area, space for parking. Inside of this area, there's a dedicated drop-off space that's been designed with both warmth but safety and security in mind as well. There's even designated spaces on the interior for our first responder partners to go into if they need to finish charting or even debrief with one of the workers at the crisis center. But two different ways of coming. There's the front door, then there's the EMS entry. And again, this can accommodate both voluntary and involuntary individuals. And the last rendering on the next slide, this shows what we've talked about, and I believe you've heard us mention when we've said the crisis observation unit should have this fusion model or this living room retreat model or this open environment. So we want individuals to be in as comfortable of a setting as possible while still meeting all the requirements for safety and security. So what you're seeing here is an open care desk towards the top right of this image where individuals in care can see those that they're working with. You have staff members that are hopefully blending in the image, but they're noted and wearing black collared shirts. Those would be the staff members, but they're out in the environment, high engagement, high touch, a very normalized setting for someone experiencing crisis to still be able to receive the care they need. But there are one-on-one rooms that you can move into. We've been intentional about bringing in that natural light and having that glazing approach. You can see on the right, or I'm sorry, the left of this image, there's someone that's having a private conversation in a room, potentially looking at discharge planning. And what you don't see here there are also private rooms and one-on-one visiting rooms that are immediately adjacent to this core area for those that might need that more private environment or need to be separated from a larger group from stimulation standpoint and to make sure the care experience is as optimal as possible. I believe those are all of my slides. Let me double check. Yes, that was my last slide. So before I do pass on to Allison Waters, I do want to again thank the commissioners and county administration for all of the support with this project. I'm privileged to be able to provide you all an update, but you all know that this project is happening in large part due to your support. Not only the support with the commissioners made originally, but when we came back with our budget revision and making some of the federal funding available, and then all of the in-kind support we're receiving from the commissioner agencies. The idea for this project is a community idea, and I think the execution of where we are has also been a collaborative process. So thank you very much for that. At the end, I know we will see if there are questions, but now I will hand it over to our Senior Director of Finance, Allison Waters.
Thank you, Jonathan. Good afternoon, everyone. Next slide, please. The 2023 ADAMH budget addresses multiple needs in our community. We remain on budget for our crisis center, having raised all but $3.7 million of our $59.9 million capital budget. We anticipate spending $6.2 million on our bridge program in 2023, with $5.8 million of that coming from levy dollars. Of that $5.8 million, $4.6 million comes from money that had been set aside for NetCare if they had continued to provide those services. The remaining $1.2 million comes from levy funds within the social services line. The largest three categories within our 6 systems of care include treatment, crisis, and prevention, with more than $94 million of the funds distributed among those 3. In 2023, we will continue the audit process to be proactive and ensure our financial practices are up to date and fiscally sound. As in 2022, we will auditors to examine our financial process and policies. Our special audits in 2022 included cybersecurity, human resources, payroll, asset management, and grants management. ADAMH will roll our 2022 independent audit, formally completed by the Auditor of State, into the county's audit. Our network of providers and ADAMH will face some significant challenges in 2023, including a continuing shortage of workers, including social workers, nurses, therapists, and clinicians critical to doing the hard work, a looming recession that could result in spikes in behavioral health needs across the community. Research consistently shows a strong link between worsening mental health and economic downturn in both children and adults. Continued projected growth of needs for behavioral health services. In spite of these challenges, we believe we are financially sound, have been fiscally prudent, and are well positioned to address the changing needs of our community. Next. This slide shows a basic breakdown of our revenue and expense budgets for 2023. The majority of our revenue is coming from levy funds, as it does every year. That will be 73% of our budget for next year. 90% of the expense budget goes to our providers to serve our community. Next slide, please. The 90% that fell under providers on our last slide is broken down here by our 6 systems of care. As mentioned earlier, the majority is going to prevention, crisis, and treatment, but we still have significant investments in recovery, housing, and family support. These figures do not include any of the capital expenses ADAMH or community partners are providing for the Crisis Center. As we enter 2023, ADAMH will continue to provide the residents of Franklin County with strong value and quality service at a cost consistent with the levy plan. Now I'll hand things over to Clark Jones, our CEO, for closing remarks.
Thank you, Allison, and thank you to this incredible team at ADAMH. Commissioners, we appreciate your time today, and all of the directors and county administrators. This is an honor for us to come before you to talk about our priorities and how we align with Team Franklin County. We are happy to take questions at this time.
Hi, this is Commissioner Boyce. Sorry for the background noise. I'm actually traveling, so I apologize that I couldn't be there. For those who don't know, I'm in DC at the freshman orientation for congressional members. And so it's just a lot going on, so I'm trying to be on these. But one thing about your presentation, thank you so much for the presentation today. I will tell you, it's a lot when there's a lot of presentations, like people talking, and it goes on for a long time. Then you got to go back to your question. So I'm so sorry, but going back to your original statements about the closure of NetCare and about the Crisis Center, can you talk somewhat about the plan inside of the jail? We've invested a lot of resources there, and talk about just the process to when someone, when you're evaluating someone on that side of the fence, if you will, and how we're going to be connected to the system so that they can access mental health services if they need it. We just want to make that more seamless than it is today, where you can end up more so in jail than in the mental health side of things. And so I want to kind of hear more about just that part of it.
Thank you, Commissioner Boyce. And before I turn to my colleague, Sue Valillo, just to talk about some of our efforts with the jail and with law enforcement in general. I want to say that regarding the NetCare closure, NetCare has been a key partner of ours in the community for decades. And one of the things they did do was see those individuals in partnership with the courts that had to be probated. They would evaluate them. And so there are those functions that will still continue in the community. But I will turn to Sue Valillo. I know we have met with individuals from the jail to talk about some of those early conversations, and then how we see the flow of individuals that come into our correctional facilities, and then their connections to community-based care, which, by the way, we have been doing and supporting through some of our key providers that do jail in-reach. And it happened at the old facility and will happen at the new one. So Sue, I will turn it over to you to hit highlights in this space.
Great, thank you. And wonderful question, I appreciate it. So before I talk about the jail specifically, let me talk about prevention for folks who are having a behavioral health crisis, not going to jail. And there really is a twofold answer to that. One is the crisis intervention training that we're doing with law enforcement that gives law enforcement officers tools other than taking folks to jail when they're interacting with them and the person is experiencing a crisis. So that has been extremely well attended by all law enforcement jurisdictions within Franklin County, not just CPD and the sheriff's office. So we do those trainings about 5 times a year. We have approximately 40 officers in attendance at every training. So we are really working hard to ensure that our first responders know what to do other than jail when interacting with someone who's experiencing a crisis. The second then is really going to be the crisis center and having that availability of services 24/7 without having to go on divert will really give officers just another tool that they can rely on to getting people to care rather than getting people to jail. And then I will share that we have been working with the jail. We do have our funded providers in the jail doing in-reach, ensuring that people in jail are linked to services back out in the community. And these are ongoing conversations. And as services at the jail expand in the behavioral health treatment space, we continue to have those conversations, everything from treatment to discharge planning to even guardianship services for someone as they're exiting the facility. So it's an ongoing conversation, but it's a deep partnership.
If I could jump in just really quick, Commissioner, Director Pride is on this Zoom as well. And thank you, Director Clark Jones. As you all know, we are doing a one-door approach here in Franklin County and working with all of our partners. I know that Director Pride is working with you all as well. And I don't know if you want to speak to that regarding the RSC. In addition to, you all were very key in working with Franklin County and collaborating for our Incredible Minds project, correct?
Director Bivens or DCA Bivens, you are exactly right. Just speaking about Credible Minds, we were very happy to have our team members sit alongside yours in bringing this resource online. We think there's lots of opportunities to grow and connect with 988 as well as community-based providers. When it comes to our conversations with Director Pride, I know she's been in contact with Dr. K, myself. We are absolutely a part of the planning around that system. And so we look forward to what will come from those partnerships. And I don't know if Dr. K or Sue Valillo, if you had anything else you'd like to add. Thank you. Nothing further on that.
Commissioners, are there any questions for ADAMH?
Yeah, I have a question, and I'm more in the numbers. Thank you for the overview. I have a question when I'm going through the papers now. There's some, I guess, decreases for the 2023 recommended budget versus what was approved for 2022. And so if you could talk to me a little bit about the decreases in the recommended budget versus the anticipated expenditures.
I'll turn to Allison Waters for a response here.
Yeah, give me 1 second.
Allison, I just want to make sure you heard the question to the best of your ability.
I did. I am just going to, I was looking up something to make sure I give a correct answer, so bear with me for 1 moment.
While Allison is doing her background, I just want to acknowledge she's one of the newest members of our team and joined us about, I don't know, maybe 4 weeks ago or so, and she's doing a great job. So we really appreciate her and her experience with county budgets.
Okay, sorry about that. So the difference between the 2022 approved and 2023 recommended, we're having about an 8 million decrease from the 2022 approved to the 2023 recommended. And that's primarily attributed to the decrease in state grants from statewide mental health campaign, which is $4.3 million decrease, revenue from other governments, which is $3.8 million, federal grants, which is also $3.8 million, and operating transfers in of $3.9 million. And those are partially offset by increase in private foundation grants of $3.7 million and real estate taxes of $1 million.
Thank you. So yeah, I mean, I see that in the write-up. So are these from at least the grants? Is this because grants are ending, won't be renewed? What?
That would be my understanding. I unfortunately don't have more information at this time.
On individual ones, we can certainly provide additional context if you are supportive of that, President Crowley. But there are some federal grants and grants afforded to alcohol, drug, and mental health boards across the state that have been reduced. An example of that is our state opiate response grants. That grant, which we have enjoyed having those resources in our community for the last several years, was reduced by about 30% in the upcoming year. And so several of the ADAMH boards are responding to the reduced amount of funding. There is an effort from our state partners that request that we braid funding from our local levy resources with that of the state grants that are coming our way as well to address tough challenges.
Okay, thank you. And then I see, and I could be off, so Zach, if you need to chime in, please do. So I see the recommended budget as 133,100,159 for 2023. Is that correct?
That is correct, Commissioner.
Okay, but then we also, for 2023 expenditures, 174 million.
That is correct. And I believe a large part of that as well is due to timing of the receipts and expenditures for the crisis center. So the cash coming in built up the revenue, and then the expenditures are kind of being paid out of that cash balance.
Okay, all right. So we're gonna talk about the difference. But okay, all right. And I saw you popped on camera. I didn't know if you had something that you wanted to add.
This is a county administrator. Going back to your original question, the sharp decrease in the 2022 projection, and it bouncing back up to the recommended amount of 74.3 million, as has been stated. They had lower than anticipated expenditures related to that building construction for the crisis center, as well as the opioid public service announcements is 5.9 million less than anticipated. The denial high. So it's not a function of a lower level of service being provided that I think is important for the record to state. That it's not a function of fewer services being provided in the community. Is lower than anticipated capital expenditures and a promotional campaign.
Okay. Thank
to
you.
beat the stigma.
Yes. And just on that campaign, we continue to work with our private sector partners. There may indeed be an infusion of resources to continue and deepen that campaign in 2023. We're working with our private sector partners right now in the Opioid Alliance to determine what that will be.
Okay. And then as far as the crisis center is concerned, I was trying to write down notes as someone was speaking about it and the campaign to raise funds for that. So is there still a $3 million difference and what still needs to be raised for that?
Yes.
Right. Okay.
Yes, and we're very excited about that, President Crowley, because that's not where we were last year. And so we are thrilled that we have been chopping down that deficit for the center in terms of our campaign to raise dollars. Originally, we had always planned to raise about $9.5 million from the philanthropic sector. We're making significant progress. We think that small gap of just over $3 million left to raise is attainable. We continue to be in conversation with several other foundational partners that are very interested in the development of this center, but we also enjoy the support from companies like AEP, Nationwide, and so many other local companies. Additionally, we will launch a public campaign so that any member of our Franklin County community or outside, frankly, that wants to support this work can do so. We have already received generous gifts from private families who have either lost a loved one to substance use disorder or had a challenge with their mental health diagnoses and want to give back to the community in this way. And so shortly after groundbreaking, we do plan to launch a public campaign, and we feel very confident about closing that gap here. My hope would be by June 30 of this year, but definitely no later than calendar year 2023.
Thank you. The other question that I have when it comes to, I guess, salary and wages from the levy fund. So 2020 was 6.4%, and 2023 is 4.5%. There was a decrease of like 1.9%. So just wondering, I guess, why the change?
And Commissioner, I can, on behalf of ADAMH, so that is related to the vacancy credit. So as ADAMH has become fully staffed in recent years, so the amount of deduction from full payroll that we take as part of the budget process, that has declined as they've been able to kind of fill positions.
Staff up. Yeah, okay, just staff up. All right, thank you.
So as the senior commissioner, whenever I choose to pay deference to my colleagues and allow them to ask all their questions first, I always end up getting all of my questions answered. Because Commissioner Boyce certainly asked my question as it related to your efforts at the jail, and Commissioner Crowley asked my question as it related to the deficit in the building fund for the crisis center. That being said, very excited about the crisis center. We've been talking about it for quite some time, and so my only question as it relates to the crisis center questions as they relate to the crisis center would be, and I think you guys may have addressed it in your presentation. I think Jonathan did, but if you could go back, if you wouldn't mind, can you remind folks when are we expected to go online? Again, because I know I missed it. And I know we've talked many times about how many beds, but how many folks we can address or expect to be able to address at any given time in the community. This is just such a wonderful facility for this community, but for any community our size. And the work that we're going to be able to accomplish, and the good that we're going to be able to do with in this community, because through these this type of facility is gonna matter. And Commissioner Boyce raising the issue earlier, we have been focusing on the type of work and the type of care that we're going to have to provide through our correction facility. And so working with you and your team on that is going to be crucial as well. And anybody can answer the question. I'm sorry, I didn't mean to.
Jonathan, I'd love for you to go ahead and answer the commissioner's question about the volume and how many folks we can see, among other details.
Absolutely. So Commissioner O'Grady, in terms of the go live, if you will, so our construction schedule right now has us having occupancy of the building, targeted for late September, early October of 2024. Then there are some post-occupancy licensure and certification requirements that'll have to occur before we can begin rendering services. Our partners at the state are very aware of this project. They're working very closely with us, not only on what we've been standing up for bridge solutions with net cares reduction, but also in planning for the new crisis center. So we anticipate that we'll have a lot of support in expediting that. But that's why we say early 2025, because there are some of those walkthrough timelines that are out of control of ourselves or even the operator of the facility. So early 2025 for services. Point in time capacity, the walk-in clinic can have 4 individuals. The 23-hour observation units, and there are 2 separate units, can have a total combined of up to 60, and then the inpatient unit can have 16. So that would be 80 individuals at a single point in time receiving care in one of those 3 units. Each unit will have a different targeted and average length of stay. The walk-in clinic, you're probably thinking 3 or 4 hours. The observation unit is probably around 18 hours. And the inpatient unit is a multi-day unit, 3 5-day length of stays will not be uncommon. But in total, the programming is designed to be able to handle and support over 34,000 encounters a year across those 3 different levels. And so just looking at total capacity, it's a significant increase primarily in that observation level of care. I think at our peak in the last, looking back at the last 10 years or so in our network, our peak was probably 17 units of that observation level of care. And by growing that up to 60, we believe it'll alleviate not only pressure on our emergency departments, also creating capacity so first responders and law enforcement aren't diverted to other locations, and keep us on pace with the anticipated growth in demand.
Thank you.
Thank you for the questions.
And commissioners, if there's no other questions, that would conclude this afternoon's hearing for the Alcohol, Drug, and Mental Health Board. So I'd like to thank Erica Clark-Jones and the members of her team for today's presentation.